everyone. My name is Dr. Pratibha Gupta, and I'm the Associate Professor and also Extension Specialist for Food, Nutrition, and Health. And I am from Dayton, Ohio, USA. And I'm also the Project Director for USDA, National Institute of Food and Agriculture, in the area of food, nutrition, and health, and nutrigenomics. My topic today is about the heart, in heart and healthy heart eating as well, and what is the nutrition gap in between. Next. As you all know that, I'm sure you probably have seen the heart. Heart is basically is the organ where you have the transport of oxygen through arteries and veins. And ideally, if your heart is functioning normally, and you see the heart functions requires the oxygen consumptions. Next. And if you see that, it's a very good question about nutrition gap in between because of the fact that the American Heart Association recommends that we ideally should be eating the fruits, vegetables, whole grains, and high fiber foods, and the fat-free and low-fat-free diet, dairy most likely. But again, if you see the total fat intake between 25 and 35% of the calories. But again, I also using natural vegetable oils, which includes your canola oil, saff oil, and also the olive oil. Okay, and using the other foods such as, for example, avoiding other foods which are not necessary for your body, which includes your fast food like French fries, donuts, cookies, crackers, muffins, spices, etc. So these are the one that really is not acceptable for the body's heart function. Next slide, please. Now, if you know that, and it is very, very interesting to see that, how much is good to eat, which is a very interesting question. The question is that a lot of people get excited about, cholesterol. People say cholesterol. Why it is cholesterol? People get so even scared about that. But in reality, there is a essential cholesterol is also needed for your diet and for your body, which means that ideally you could have 200 to 400 milligrams of cholesterol per day, which is required for the body. Now, sodium quantity is about 2,000 to 3,000, milligram per day, or, on protein, which is about 60 to 120 grams per day, which is very normal. And ideally, we don't do that, right? So, or in the case, 20 to 40 grams per meal. Carbohydrate and fibers are necessary diets as well. Is about 25 to 30 grams fibers per day, or 5 to 10 grams of fiber per meal. So all of these things relates to about the body structure, what body structure you have, and what is your body lifestyle is, and how much you are consuming without activity. That also matters. For example, if you are very high active person, your diet may change, and your diet may require something additional, inclusion of protein, fat, and carbohydrate. Next one, please. Now, sometimes we always ask this question, my heart and heart healthy eating. Now, and if you see, there's the heart disease, the cardiovascular diseases are the leading causes of death in America. And it's shocking, very, very interesting, shocking to see as 1 in 3 adults has at least some form of heart-related conditions. And these risk factors are very, very, interesting in the sense that it used to be age 40 and 50 and above that people would have the cardiovascular diseases. But currently today, the age has changed. In current times, the age of cardiac arrest or cardiovascular diseases are less. 30, 40 years of age or even 25 years of age could have these risk factors of heart conditions. And I can guarantee you it is most likely related to our improper lifestyle of food habits. Now, unhealthy blood cholesterol levels like high LDL and low HDL. Now, people usually have to understand that low density lipoprotein, which is more dangerous in the body, And if it increases, that it again gives you the chances of floating in your blood circulation low density lipoprotein. And high density lipoprotein is decreasing because of inactivity and other factors, which is the inheritance or added or acquired habits. If you do not have a good high density lipoprotein, chances are your LDL or low density lipoprotein are going to be circulating in your body. So it is ideal in a situation that we have to have a high density lipoprotein higher in the body. Also, the high blood pressure is another cause. The high blood pressure, of course, high blood pressure, if you see majority of the foods that we eat as a fast food has a high amount of salt. That also is a leading cause of creating high blood pressure. Smoking is the other one. Smoking and also insulin resistance. Majority of the people who have the insulin resistance or having diabetic conditions can also have the heart conditions. Being overweight or obesity is another cause of having heart conditions because of the fact that lack of exercise develops the lack of oxygen in the body. And lack of physical activity leads into incapability of body circulation, blood circulation, as well as decreasing the oxygen consumption. So the oxygen consumption is less, and oxygen that is required for red blood cells to transport oxygen from one cell to the other cell and rest of the body. So if you have a lack of oxygen, the lack of oxygen also creates a discrepancy because it is required to your brain cells. So lack of oxygen will create something disbalance in your brain, and brain can also be affected. And in that case, sometimes it can also be a cardiac arrest or some conditions where brain cannot succeed, brain cannot perform well. Next one, please. Now, what exactly we should be eating now? Look, think about that. So there are a few things I'm going to be talking about is that, for example, monosaturated fats. The monosaturated fats, they're basically present in your vegetable oils. And majority of the time, if canola oil or olive oil and peanut oils are used, that is fairly good in a condition. They are also liquid at room temperature. Eating foods high in monounsaturated fats can help lower your LDL and cholesterol and raise your HDL cholesterol and decrease your risk of heart disease. But again, it is not recommended that you have to eat food like a fried food on a daily basis. If your consumption, which is big, any liquid which is at room temperature, would be good to eat. Now, polyunsaturated fats are mostly in vegetable oils, for example, sunflower oil, corn, flaxseed, and canola oils, and some of the seafoods are also. Now, these polyunsaturated fats also required for for cell structure and for making some hormones. As you know, that there are some hormones, those are fat soluble hormones. There are some vitamins which are fat soluble as well. So if you don't have enough fat content in your body, vitamin A, vitamin D, vitamin E, and vitamin K may or may not be ready to be absorbed in the body. So that is also necessary. So we should have some fat content in your body as well. Next one, please. Now, the good fats, saturated fats, trans fats. Saturated fats are mostly found in animal meat or animal food and poultry, and also some butter. Now, vegetable oil, for example, coconut oil, palm oil, they're very, very highly saturated. Now, these trans fats, sources of trans fats include snack foods and baked goods with the partially hydrogenated vegetable oil or vegetable shortening. Now, these things are not as quite good to basically consume. And as I mentioned before, what kind of oil, the ideal oils are canola oil or olive oil is good for your health conditions. Reason why? Canola oil is also very good in the sense because it is heat sensitive, not heat labile. If it's heat's stable, that means if you fry something in there, it will not break its chain. And the break chain of the fat will not cut down into small particles of the oil, and small particles which is broken by the intense heat will be different. So canola oil does not break the chains in between, even though it is a high temperature, it is heated in a high temperature. In that case, that it does not create any other cancer causing agents. On the other side, olive oil cannot be heated. It must be eaten as a oil, as a cold oil, because olive oil is a heat labile. That means if it's heated, it will break into pieces, and it may be a cancer causing agent as well. Next one, please. Now, again, we also say that, if you have to make sure that, your cholesterol is, to be, kind of treated well, we should add soluble fibers in our diet as well, which includes your oats, your dried beans, peas, barley, and some fleshy parts of the fruits and vegetables. And these can also enhance the capacity of the soluble fibers. And these soluble fibers can be good into creating your or improving the quality of cholesterol. And because soluble fiber dissolves in water and creates the substance that can actually bind with the cholesterol, and then cholesterol can be removed. About 20 to 25 grams of soluble fiber daily can increase the level of LDL or bad cholesterol by 5%. So eating daily for vegetables and fruits, and also high fiber cereals and beans and soups and salads, and all also oatmeals and barleys and other things, and peas and beans, and these things can enhance your good quality of life, and also improve the lower the LDL, which is low density lipoprotein, or the bad cholesterol. Next one, please. Now, as you can see that how the soluble fiber may lower your blood cholesterol, which means that I will give you this example here. Is that okay? Let me give you that. Um, So first of all, when you eat your any soluble fiber, it goes to your stomach, it goes to your digestive process, and the digestive process happens, and then what happens that you are actually going to create something, the soluble fibers will basically have the additional enzymic secretions, enzymic digestive juices mix with that, and take out some of the soluble fiber into your circulation. And also, it will create how it will bind with your other substances to make sure that it is bound and that it's excreted out from the digestive tract. So that way, it will also cleans up the system, which brings out the low density cholesterol out into the body. Next one, please. Now, again, as I mentioned before, the soluble fibers can help lower blood cholesterol. So, ideally, if you have these diets, in your regular diets, in your daily regular diets, that includes your oatmeal. I already shared that with you. Oatmeal, so your apples, bananas, and green beans, sweet potatoes, lentils, and black beans. All of these foods have one thing in common. They also have a fibers, they have a skin, and also they have the capacity of some protein content, and that includes with along with the fibers, gives the good food habits. That means that they all combined together will create the protein content as well as fiber content, as well as the and if you eat more fibers in your diet, definitely you'll be drinking more water, so you'll get more hydration. And if you have more hydration, you have more absorption of other minerals and nutrients in the body. That is why it is essential that we include these food habits in our diets, which I already mentioned to you: oats, barley, rye, and other, fruits that has more textured food, or fruits with the high content of fibers. Next one. Again, it is not very, I'm just going to give example of that, in case if somebody wants to know about that, how much to eat, about 1 to 2 grams soluble fiber you can add in this in diet. For example, if you really don't know exactly which one to eat, you definitely can have some kidney beans, or cooked artichokes and Brussels sprouts. This is just a very common food that people can usually eat and to increase the fibers in their diets. Next one, please. Again, these are some of the examples. I mean, I don't have to drink. I will just share that with you. And I'm sure I definitely know every one of you knows about that. Like avocados, prunes, and, peach, pears, apples, oranges, grapefruits, chickpeas, navy beans, pinto beans, black beans, lentils, and beans, soybeans, and raisins, oat brands, these, and also some of the vegetables like carrots, onions, peas, broccoli, sweet potatoes, winter squash, baby carrots. All of these things not only just contain the fibers, but at least they also have minerals and nutrient, which is very, very highly absorption. They can absorb into the body and give you the content of vitamins, vitamin A, vitamin D, vitamin E, vitamin K, vitamin C, vitamin B, and all those B vitamins all together. Next one, please. Now, also, you all probably have heard of that omega-3 fatty acids. As we grow older, omega-3 fatty acid and omega-6 fatty acids are essential in our body. And unfortunately, omega-3 fatty acid is not stored in the body, or it's not built in the body. And our nerve cells and neurons definitely will require both omega-3 and omega-6. So it is essential that for the cardiovascular health, we all need these omega-3 fatty acids as well as omega-6 fatty acids. Omega-3 and omega-6 fatty acid in combination, it survives the and also gives the nutrition to our nerve cells and neuron cells. As you know, nerve cell neuron cells are essential for our brain sensitivity and brain memories, brain power, right? So brain is not functional properly. Definitely we know that. Brain means a lot of bodies normal function, please. And now again, you all can say that what is the utility, what is the benefits of omega-3 fatty acids? Now you all probably heard of that, fatty acids. Fatty acids sometimes if it's misinterpreted a fat, it's not actually. Omega-3 fatty acids are good fats. It maintains the healthy eyes, improves the depression, it also controls the triglyceride, and also improves the quality of HDL, which is high density lipoprotein, and it also prevents the blood clots, and it prevents the heart health. It also prevents cancers and improves the sugar level in the body, and also maintains the blood pressure in the body. So it is necessary to include omega-3 fatty acids, or the omega-6 fatty acid in your diet to improve the cardiovascular health. Thing. Next one, please. And I'm sure I'm not going to do this all because you all probably heard of these things, like how there was a myth also that egg yolks contain cholesterol. Yes, it is true, but the cholesterol, it is eaten on a regular basis or in a controlled quantity, may not affect. And some people usually use that, different type of yogurt, fat milk and yogurt, and other things that are utilized, or flaxseed, which is essentially a high in omega-3 fatty acid. Some of the dry fruits, walnuts, these are also good. They are also rich in these omega-3 fatty acid, and that are very good. Some people who are strictly vegetarians cannot use all those fish oil and other things, but they can also concentrate on some of the dry fruits, like walnuts and pecans and other dry nuts that are essential, really great in omega-3. Next one, please. And this is very interesting to know that, and I'm sure you probably have heard of that. In current times, in United States, people have started to use that the larger size of all those fast foods. And it used to be short and small containers, but today larger size of French fries, larger size of cups and coffees are being sold in the restaurants. So obviously, the chances of getting overweight, chances of getting more conditions, health conditions, is very common now. Next one, please. And I would think this is a slide I'm going to be talking a little bit more about that. The highest amount of fatty acids, are present in your some of those oils, which are the best oils, stands out that uh, the fatty acid content as well as the dietary is a saturated fat, or like for example, very uh, the best oil to be used in this category, if you can see that, is the best oil is a canola oil. Okay, so canola oil has the linoleic acid about 21%, and then 21% linoleic acid is really good into that too also. So now, for example, if you see that other aspects of oils, and if you see the combination of that combinations, saturated fat is very less in canola oil. If you can see all the way down in coconut oil has the high saturated content, and saturated content fat should be avoided. So ideally, if you see, the canola oil has only 7% of the saturated fat, so that means that it could be ideal oil to be used. Next one, please. Again, as you know, fat is essential. Fat is essential. Not only it, I already explained that to you, is that it is essential in your diet. Reason why? Because it makes some of the body cannot function without the types of the fat. Also because it not only it adds the flavors to the food, but also gives the hydration, and also it is required to carry vitamins and minerals throughout the body. So fat is essential. Next one, please. Now, if we see, I'm just going to give you. I showed you the diagram of the heart before, and as you know that the heart is the center of circulatory system, and the blood vessel, which is the network of blood vessel that carries the blood to the part of the body carrying oxygen and nutrients to the organs to stay healthy and work properly. Now, the heart, as you know, there it's a two it's a divided, if you see it, heart is divided in two sections. The right side receives oxygen poured from the veins and pumps into the lungs, and where the carbon dioxide is removed. Now the left side of the heart, it gets the oxygen rich blood from the lungs and pump it through the arteries to the rest of the body. So that's how the functions of the heart is constantly going on. Next one, please. Now, the as I said before, the what is the actual reason why we have a cardiovascular discrepancy, cardiovascular health, and there's quite a few reasons and multiple reasons, and there may be one or the other reasons also. It may be hereditary, and there are a lot of other factors that includes into having a heart health. People who have heart health, healthy weight balances. We have to maintaining the cholesterol levels and blood pressures and blood glucose levels, and physical activity needs to be maintained, and exposure of other products that are like a inclusion of alcohols and drugs. All of these things can impact our cardiovascular health. Next one, please. And this is I'm just going to give you example of that. Some of those labels that we get the food in United States, there's some misleading as well, right? So, for example, if you say that amount per serving, as you can see, let's say one food product has a calories, like 170 calories. The 170 calories per serving, but the content of the whole servings inside the box may be more than you actually are expecting. So sometimes you have to really read the label very well so you can understand exactly how much quantity of the food item we are taking. Next one, please. And now you probably have a question, that proportion, serving size. A serving size is essential also to maintain your heart healthy diet, which means that as much as you need, that's all you need. I can guarantee you, as much as you balance your food habits to a standardized version rather than overeating, life could be better. And also, as I mentioned, eating food on a regular scale as well as in a balanced style would be better. Next one, please. As you can see, recognize deceptive foods, right? For example, we say 100% orange juice, right? Now you understand that 100% orange juice, if you can see the label there, now how much, servings in this container is that? So let's say it says 100% orange juice, okay, and it's 110 calories from fat. Or it just says that, for example, how much calories this particular food product has. If you say 110 calories, but they have more than 7 servings per container. So that means if you're eating or drinking that whole entire container, 110 calories multiplied by 7. So more than 800 calories are already in there. So you have to really see and basically being having a mindset. What exactly are you eating? Next one, please. Again, same thing, same format. I mean, you see that here, right? Now, sodium is 180 milligrams in this case, right? And also potassium of there's no potassium in here. Carbohydrate is about 29 grams. Now you can imagine it has 190 calories. So you can imagine sugar is 11 grams. Now it looks like a very small bar, but if you one bar, if you're taking 190 calories, has a 7 gram of fat, and saturated fat about 1 gram, and trans fat about, there's no trans fat of course, but sodium is about 180 milligram. Now fiber is 2 grams, sugar is 11 grams. So you are in a confusion that should I eat that particular granular bar or not. That is how we have to understand our deceptive foods. Next one, please. Again, identify the harmful eating behaviors. That means that you really have to know exactly what you're eating, how you're eating, what your lifestyle is, how much exercise you're doing, how much you have to binging or excessive large meals, or some of the snacks that are heavily high calories, but they do not have any nutritive value. Next one, please. And as you can see here, benefits of healthy choices, right? If you have healthy choices, which means that includes that fruits and vegetables, you have vitamins A's, vitamin B. Vitamin A is essential for your optimal health. Vitamin B are good for your nervous system. Vitamin C for wound and bruise healing, as well as for your immune system. So all of these things are necessarily essential for maintaining your body's lifestyle functional, so you can maintain the healthy lifestyle. Next one, please. And again, as you all know, benefits of healthy choices, what exactly it means that, benefits of healthy choices means that you have a complex carbohydrates that includes, digestion. And also when you eat the food with the high fiber, your body makes you full, and also your digestive tract will be more digestively, it will be more helpful because your digestive tract will be more more soluble fibers will increase the binding capacity, and that will include taking out any toxins from your body. Next one, please. Again, this is all just this is my picture in that sense. What are your dining decisions? Dining decisions means that choose the style that you like and maintain on a daily basis. Have a healthy snack rather than the foods fast food style. Next one, please. Again, I'm sure you probably have heard of that, how to control your portions. Control portions, have the special, serving size only, and not overeating, and buy whole grains in a bulk so you can make more justifiable decision what to eat and when to eat and how to eat, what how much portion to eat. Next one, please. And I again mention control your portions when you're eating out. Most of the time, when we eat food in the restaurants and outside, we sometimes do not remember that we have to maintain our portion control, and the portion control is essential. Next one, please. And also, how can I control portion when I'm eating out? So, for example, if you're eating out, then you really have to know that if you're eating the whole entire meal, you can always have a small portion of the meal ordered. And even if you have more ordered, you can pack up for next day. And you don't have to eat everything on that particular time. You can always take that food later on for eating. Next one, please. And I think that's next one, please. I already did that. Next one, next, please. And that's all I have for you.